Introduction. Welcome to today's lecture on Gaucher disease. In this session, we will delve into the various aspects of this rare genetic disorder, including its pathology, clinical manifestations, and available therapeutic interventions. Gaucher disease is caused by a deficiency of the enzyme glucocerebrosidase, resulting in the accumulation of a fatty substance called glucocerebroside within various tissues and organs of the body. This disease can lead to severe complications and significantly impact the quality of life of affected individuals. To better understand this condition, we will explore topics such as enzyme replacement therapy, substrate reduction therapy, genotype-phenotype correlations, bone and hematological manifestations, neurological involvement, the link between Gaucher disease and cancer, different types of Gaucher disease, and emerging therapeutic approaches. Let us commence our journey into the intricacies of Gaucher disease. Gaucher disease is an autosomal recessive lysosomal storage disorder caused by mutations in the GBA gene. It is characterized by the inadequate activity of the enzyme glucocerebrosidase, leading to the accumulation of glucocerebroside within cells. This accumulation primarily affects macrophages, giving rise to the typical Gaucher cells seen in affected tissues. Gaucher disease is classified into three major types: Type 1, Type 2, and Type 3. Type 1 Gaucher disease is the most common and manifests primarily in adulthood, often presenting with hepatosplenomegaly, anemia, and thrombocytopenia. Types 2 and 3 involve central nervous system manifestations and can present in early childhood. Enzyme replacement therapy, ERT, is a cornerstone in the management of Gaucher disease. It involves the administration of recombinant human glucocerebrosidase to replace the deficient enzyme. ERT has proven efficacy in reducing hepatosplenomegaly, improving hematological abnormalities, and alleviating bone pain. The recombinant enzyme is administered intravenously every 2 weeks and requires lifelong treatment. In some cases, the response to ERT may be inadequate due to the presence of neutralizing antibodies or poor tissue penetration. Substrate reduction therapy, SRT, is an alternative treatment strategy for Gaucher disease, particularly in patients who do not respond well to ERT or have limited access to it. SRT involves the use of oral medications, such as miglustat, which inhibits the synthesis of glucocerebroside. By reducing the substrate load, SRT aims to decrease the accumulation of glucocerebroside. However, SRT is generally less effective than ERT and may have gastrointestinal side effects. The genotype-phenotype correlations in Gaucher disease are complex. Over 300 different mutations have been identified in the GBA gene, resulting in a wide spectrum of clinical presentations. Certain mutations, such as N370S, are more commonly associated with the non-neuronopathic type 1 Gaucher disease, while others, including L444P, are linked to more severe forms of the disease involving neurological manifestations. Genetic counseling and molecular testing are essential for accurate diagnosis and predicting disease severity. Bone involvement is a significant hallmark of Gaucher disease. The accumulation of glucocerebroside within osteoblasts and osteoclasts disrupts normal bone metabolism, leading to osteopenia, osteoporosis, avascular necrosis, and pathological fractures. Gaucher-related bone disease often requires comprehensive management, including the use of bisphosphonates for bone pain, orthopedic interventions for fractures, and regular monitoring of bone mineral density. Hematological abnormalities are commonly observed in Gaucher disease, primarily due to the infiltration of Gaucher cells into the bone marrow. Chronic anemia and thrombocytopenia are the most prevalent hematological manifestations. Anemia results from decreased red blood cell production and increased destruction, while thrombocytopenia arises from hypersplenism and platelet sequestration. Regular monitoring of blood counts and consideration of transfusion support are crucial in the management of Gaucher disease. Gaucher cells, the pathognomonic cells of Gaucher disease, are macrophages distended with glucocerebroside-rich lysosomes. These characteristic cells can be identified in various tissues, including the spleen, liver, bone marrow, and lymph nodes. The identification of Gaucher cells through histological examination or high-resolution imaging techniques, such as magnetic resonance imaging, MRI, is instrumental in confirming the diagnosis and assessing disease burden. Neurological involvement is primarily seen in types 2 and 3 Gaucher disease, which are characterized by severe systemic disease and early childhood onset. Central nervous system manifestations may include neurodevelopmental regression, seizures, gaze palsy, myoclonus, and progressive neurodegeneration. The accumulation of glucocerebroside and its toxic metabolites disrupts neuronal function and leads to progressive deterioration. The management of neurological manifestations in Gaucher disease remains challenging, and supportive care is the mainstay of treatment. Recent research has highlighted a potential connection between Gaucher disease and an increased risk of developing certain types of cancers, including multiple myeloma and hematologic malignancies. The underlying mechanisms are not fully understood but may involve chronic inflammation, immune dysregulation, and altered cell signaling pathways. Regular cancer screening and close monitoring are advised to detect and treat malignancies early in individuals with Gaucher disease. Gaucher disease is classified into three major types based on the presence or absence of neurological involvement. Type 1 Gaucher disease is non-neuronopathic and primarily affects the viscera, while types 2 and 3 involve the central nervous system to varying degrees. Type 2 Gaucher disease is the most severe form, with rapidly progressive neurological manifestations and a shortened life expectancy, whereas type 3 Gaucher disease exhibits a slower disease progression and variable neurological involvement. Gaucher disease belongs to a group of rare genetic disorders known as lysosomal storage disorders, LSDs. LSDs are characterized by the impaired metabolism of specific molecules within cells, resulting in the accumulation of various substances, such as lipids and proteins, within lysosomes. The buildup of these substrates leads to cellular dysfunction and multi-organ involvement. Understanding the common mechanisms and pathways involved in LSDs can provide insights into the diagnosis and management of Gaucher disease. Ongoing research efforts are focused on developing innovative therapeutic strategies for Gaucher disease. Some promising emerging therapies include chaperone-mediated enzyme enhancement, gene therapy, and small molecule modulators. Chaperone-mediated enzyme enhancement aims to stabilize and enhance the activity of the deficient glucocerebrosidase enzyme. Gene therapy involves the administration of functional copies of the GBA gene to restore enzyme production. Small molecule modulators target specific cellular pathways to enhance clearance of accumulated substrates. These emerging therapies hold great potential in improving the management and outcomes of Gaucher disease. In conclusion, Gaucher disease is a complex and heterogeneous genetic disorder characterized by the deficiency of glucocerebrosidase enzyme activity. The resultant accumulation of glucocerebroside within various tissues leads to a wide range of clinical manifestations. The advancement of therapeutic interventions, such as enzyme replacement therapy and substrate reduction therapy, has significantly improved the management of this condition. However, challenges remain, particularly in the management of neurological involvement and the understanding of genotype-phenotype correlations. Continued research and technological advancements offer hope for the development of more effective treatments for Gaucher disease and other lysosomal storage disorders.